Well, distinguished guests, ladies and gentlemen, my name is Khalil Sharif. I'm the Chief Executive Officer of Aga Khan Foundation Canada, and it is a very great pleasure to welcome you all to the delegation of the Ismaili Imamate for today's program. A special welcome to our online audience around the world as well. I see a lot of people who have been here before, but I did want to just open by recalling that when the delegation was opened in 2008 by His Highness the Aga Khan and the Prime Minister, they expressed a joint aspiration that this building might be used to convene those conversations that would lift our aspirations as a country for the kind of contribution we might make to a more peaceful, prosperous, and pluralist world. And we have had the great privilege over the last 5 years to bring people together and to be able to host some extraordinary people to share with us their thinking and their track record from which we can learn and hopefully to which we can contribute. About a year and a half ago, in collaboration with the Department of Foreign Affairs, Trade and Development, we launched the AKFC seminar series, where we take an issue of interest and then elaborate that issue through a series of engagements over time. The first one we did was on early human development, and the second one was on innovative finance for development. The third one we turned our minds to was a collaboration with the Canadian Network for Maternal, Newborn and Child Health, and it was a seminar series on maternal, newborn and child health, both because it was such an important part of the Government of Canada's program in international development. In fact, the Prime Minister, I think, has called it Canada's top development priority, and I'm very happy that the Prime Minister has announced that he is hosting in just weeks' time in Toronto a major global summit on maternal, newborn and child health that will underwrite Canada's global leadership on this issue. But it's also a key pillar of the Aga Khan Development Network's work in health in both Africa and Asia, where we have had many years of work from community care in the most remote and rural areas to tertiary hospital care in capitals, including in education of health professionals. We have had, over the course of the series on MNCH that's launched in September, an extraordinary array of speakers and series of conversations, starting with the launch, which was a conversation about the Lancet series on maternal and child nutrition, which we did with the MI and the network, which was great. We have turned our attention to innovative finance in MNCH. We've looked at health, human resources. And today, it's a real delight in our most recent episode in this series to talk about the role of the private sector in improving health outcomes. With some very, very special guests. But before I refer to those guests and invite them up on stage, I really want to express my gratitude to all of the panelists who have agreed to join us. And I want to welcome on stage for some opening remarks on behalf of the Government of Canada, Parliamentary Secretary to the Minister for International Development, Ms. Lois Brown. I think many of you will know her. Those of you who are involved in this sector will know that Ms. Brown has been the Parliamentary Secretary for over 3 years now and has brought a level of energy and enthusiasm and relentlessness to her duties that I think has overwhelmed even those of us who do this all the time. And it's a great delight to have Lois fresh from a trip to Africa with us here. So Lois, over to you.
Thank you, Khalil, and good afternoon, ladies and gentlemen. Indeed, I was in Madagascar and Mozambique last week, and was thrilled to have the opportunity to meet with the Aga Khan Foundation in both countries, have a briefing on the things that the foundation is doing there. So tremendous work that's being done, and it was thrilling to hear the success stories. I'm very honored to be here. I was here 4 weeks ago when we had another discussion, and many of you were here, so delighted to see some familiar faces back here again. And thank you so much for hosting us here today. You are more than generous with your facility and with your remarks. Khalil, thank you. Very sorry that Minister Paradis can't be with us today, but he did send his very best wishes wishes to all of you, and pleased to say that Dr. Berkeley and I had a very productive meeting with the Minister this morning, and I'm sure that he's going to talk about those things in his remarks. As Khalil said earlier, the Prime Minister recently announced that Canada is going to host a high-level summit on maternal, newborn, and child health in May in Toronto. And I was really pleased to hear you use the word aspire, Khalil, because it is one of the areas to which Canada aspires to do great things. This summit is going to bring together key Canadian health experts and global leaders to take stock of the progress we have achieved and to build consensus on the way forward. In 2010, Prime Minister Harper brought much-needed global attention to child and maternal mortality in developing countries when he held the G8 Muskoka Initiative for Maternal, Newborn, and Child Health. And with his leadership, Canada mobilized support from other G8 countries, donors, international organizations, the private sector, and foundations. Together, we pledged to save the lives of 64,000 women and 1.3 million children. I was in Mali in September. I was asked to go and be the representative for Canada at the inauguration of the new president in Mali. And while I was there, I did a couple of site visits to some of the projects that Canada has invested in. One of the places I visited was a hospital for maternal, newborn, and child health. My friends, I held in my hands a baby girl before she was even named, 4 hours old, and this little girl weighed 4 pounds. Because of the things that you are doing out there, this little girl has life and a hope and a future. Her mom would never have survived in her village, but because of the work that you are doing, because of the ability to identify a difficult pregnancy and what was going to be a very challenging delivery, that 16-year-old girl was moved to that hospital in Bamako, and she is alive today, and that baby is alive. So congratulations, because it's because of your efforts that that little girl is going to have life and a future. It's nearly 4 years since the launch of the Muskoka Initiative. Maternal mortality rates are declining, and millions more children are celebrating their 5th birthdays. This, in large part, is thanks to partners like the Gavi Alliance and the Canadian Network for Maternal, Newborn, and Child Health, including the Aga Khan Foundation. Unfortunately, we know that even with this progress, it remains unlikely that we will fully meet the Millennium Development Goals in this area. Last year alone, more than 6 million children died from preventable diseases before their 5th birthday, and nearly 300,000 mothers died during pregnancy. This is why Canada is seizing the opportunity to mobilize leaders and health experts once again and to galvanize support for the next phase of our efforts on maternal, newborn, and child health. Our goals are within reach. And when I listened to Dr. Berkeley this morning and the very positive things that are happening, I so look forward to him telling you those stats this afternoon, because our goals are within reach. But in order to get there, we need to be more effective, more focused, and more innovative. One of the key focuses of the summit in May will be the importance of broadening our partnerships with the private sector and using innovative financing to reduce the preventable deaths of women and children in developing countries. Collective action is essential in tackling these problems. Going forward, we need to leverage additional capital, innovation, and the technical know-how of the private sector. Partnerships with leading Canadian businesses, civil society, and our key global partners can provide a strengthened approach. And we know this because we've already seen what public-private partnerships and innovative financing can do. And I can think of no better example than Canada's support for the Gavi Alliance, a world leader in immunization. Gavi has all the elements of a successful public-private partnership. It combines the technical expertise of the development community with the business know-how of the private sector. It harnesses the technical expertise of the pharmaceutical industry to ensure that new vaccines are developed. It works with donors to ensure that health is prioritized in programming. And it works to strengthen country health systems and to engage civil society organizations, including you, to ensure that these vaccines are delivered to the poorest and the most vulnerable communities in the world. Businesses invest in the Gavi Alliance because they know that immunization is one of the most cost-effective ways to promote global health. Vaccines provide a strong return on investment, and companies recognize that when women and children thrive, economies thrive. Donors, like Canada, support Gavi because of its impressive track record in delivering results. Since 2000, Gavi has helped to immunize 440 million children. This track record is why Canada became an early donor to the Advanced Market Commitment for Pneumococcal Vaccine, which is being administered by Gavi. As many of you know, pneumonia is one of the biggest killers of children under the age of 5 in developing countries. For a new complex vaccine to reach these countries, it normally takes 10 to 15 years. Through this initiative, donors work with the pharmaceutical industry and local governments to speed up the development and availability of the pneumococcal vaccine for the world's poorest countries and to lower its cost. 4 years after the launch of the Advanced Market Commitment, the price of this life-saving vaccine has been reduced by 95% for the world's poorest countries. It is being rolled out to 30 countries as we speak. This is the type of innovative business model the Canadian government endorses and financially supports. The outcomes of this meeting will be helpful to the Prime Minister and to Minister Paradis and myself as we support our Prime Minister in his preparations for the summit in May. I know I always tell this story, and some of you who have heard it before are going to say, oh, she's going to tell this story again. But you know, I have to tell you why this is so important to me. I want to tell you the story about a young man who came from Ghana to Canada to do a second master's degree. He arrived with a master's degree in physics. He did a second master's degree here in material sciences. He went on to complete his doctorate in electrical engineering. Kofi, Dr. Asante, is now back in Ghana, where he is originally from, and he is supervising the master's classes in engineering at the University of Mining and Technology. With him is his bride, Shannon, who is teaching grades 4 to 6 English in the local school. And why is this so important to me? Because Shannon is my daughter. My daughter is living in Ghana, and I want to know that the opportunities are there for her and for all of the young women with whom she works, that they are going to have, like that young mom in Mali, life and hope and future. So thank you so much for what you're doing. I look forward to the conversations that we're going to have here, and thank you once again for inviting me to be part of it.
Thank you, Lois, for those welcoming remarks. Well, let's now turn our attention to the matters at hand. We're very delighted to have an extraordinary group of people to discuss global health in the world of business, and our moderator today actually needs no introduction. Catherine Clark, who is the host of CPAC's national television show Beyond Politics, is going to deftly take us through the bevy of issues that these thoughtful people are going to lay on the table. So let me leave it now to Catherine to take us through the rest of the program. Catherine, over to you. And maybe I'll invite the speakers up, the panelists up too. Are you going to do this first? Okay. Over to you.
I was just saying to Lois Brown's assistant, Josh, that I can always tell the people who've completely fallen off the brink of the the real world, into the world of politics and organizations working to make the world a better place. I think I'll just put it over here. I think I'm okay. Yeah, thank you, Helen. When they tell me that they watch CPAC regularly. So it was nice of you to say I may need no introduction, but I have a feeling that there are a few in the room who have no idea what I do. So again, I'm Catherine Clark. I'm delighted to be here today. These are important causes, important discussions. I'm the mother of 2 young children. I'm involved with Care Canada. I feel very strongly about the need for us to focus heavily on maternal and child health in the developing world. There is a tremendous amount that we can do, and I'm delighted to be able to introduce our panelists for this very interesting discussion today. I'll introduce each of them individually and then ask them when their introduction is done to join me on the stage. Dr. Seth Berkley is the Chief Executive Officer of the Gavi Alliance. He joined the Gavi Alliance as CEO in August of 2011 as it launched its 5-year strategy to immunize 250 million children in the developing world with life-saving vaccines by 2015. Prior to joining the Gavi Alliance, Dr. Berkley was the founder, president, and CEO for 15 years of the International AIDS Vaccine Initiative, IAVI, the first vaccine product development public-private sector partnership. Sous sa direction, l'IAVI a mis en œuvre un programme mondial de plaidoyer pour que les vaccins reçoivent toute l'attention des médias, de forums tels que le G8 et notamment de l'Union européenne et des Nations unies. Il a également supervisé la création d'un groupe virtuel pour la mise au point d'un vaccin regroupement secteur industriel, monde universitaire et scientifique des pays en développement. Prior to founding IAVI, Dr. Berkley worked for a variety of international organizations dedicated to global public health and the common good, such as the Rockefeller Foundation, the Center for Infectious Diseases of the U.S. Centers for Disease Control and Prevention, the Massachusetts Department of Public Health, and the Carter Center. Dr. Berkley, who amongst other awards and titles has been recognized by Time magazine as one of the 100 most influential people in the world, has consulted or worked in more than 25 countries in Asia, Africa, and Latin America. He sits on a number of international steering committees and corporate and not-for-profit boards, including those of Gilead Sciences, the New York Academy of Sciences, and the Acumen Fund. It's a pleasure to ask Dr. Berkley to the stage. Mark Levanen is president of Sanofi Pasteur Limited, the Canadian vaccine division of Sanofi. Sanofi Pasteur researches, develops, and manufactures vaccines for Canadians and for export to global markets. Mr. Levanen has been with the company since 1983, serving in numerous senior management positions before his appointment as president in 1999. Including as Senior Vice President and General Manager of the Oncology Business Unit, where he was responsible for the strategy and funding of Sanofi Pasteur's cancer vaccine program and the global marketing and sales of its cancer immunotherapeutic products. He currently serves as chair of RX&D, Canada's research-based pharmaceutical companies. Monsieur Levanen est également directeur d'Oncolytics Biotech Incorporé, de l'Ontario Institute for Cancer Research, du Forum des politiques publiques, de l'Université York, de Biotech Canada et de la Fondation de l'Hôpital Markham Stouffville. Mr. Levanen is a past chair of a wide variety of important health-related institutes and steering committees and was a co-chair of the Ontario-Quebec Private Sector Advisory Committee and a member of the Ontario Investment and Trade Advisory Council, the Bio Council, an advisory group of the Government of Ontario, and the Toronto Mayor's Economic Competitiveness Advisory Committee. Mr. Levanen has received numerous awards over the course of his career, including a Chevalier de l'Ordre National de Mérite from the Government of France, a Queen's Diamond Jubilee Medal, and he was inducted into the Canadian Healthcare Marketing Hall of Fame in 2013. Mr. Levanen. I should also say that Mr. Levanen introduced himself to me by saying that many years ago, I have a father who used to be in politics, and during the 1980 election campaign, apparently on Valentine's Day, he took his girlfriend to hear a political speech, and I then asked if that woman had ever agreed to marry him. He said yes, so there you go. Joel Spicer is the president of the Micronutrient Initiative, an internationally recognized organization dedicated to ensuring that the world's most vulnerable, especially women and children in developing countries, get the vitamins and minerals they need to survive and to thrive. The Micronutrient Initiative is a global leader in advancing integrative, innovative, and sustainable solutions to reduce vitamin and mineral deficiencies through advocacy, technical, and programmatic support in collaboration with other organizations. Monsieur Spicer est un chef de file en santé mondiale reconnu, un innovateur, un visionnaire et un Canadien dont la grande expérience en développement international dépasse les limites géographiques, sectorielles et organisationnelles. He has worked with the Canadian International Development Agency, where he began his career, UNICEF, the World Health Organization, the World Bank, and others. Dernièrement, il a rejoint l'équipe dirigeante du partenariat HALT à la tuberculose. Over the course of his career, Mr. Spicer has applied a strategic perspective and focus to a wide range of development issues, including nutrition and health initiatives, maternal, newborn, and child health, TB control, HIV programming, and innovative financing. He has a proven track record of success in expanding the relevance, reach, and impact of organizations he has worked with through his strengths in negotiation, his ability to increase engagement with a wide array of political, corporate, and public stakeholders, and his progress in transforming the global conversation among key influencers. Joel Spicer. And so that is our panel. I'm going to take my seat now. We have a series of questions. I have a series of questions that I would like to ask, but once we've had an opportunity to answer a few questions, I really would warmly welcome any questions that members of the audience have. I don't really think we'll need a microphone, but we have microphones should they be necessary. And when we get to that stage, I'll be certain to let you know we're there. And also encourage you, if you do have questions at that point in French, don't hesitate to ask those questions in French. I can't guarantee my technical French on these issues, but we have several people in the audience who can help us out. So let us begin. We heard, gentlemen, from Lois Brown about the fact that partnerships really can make all the difference in ensuring that healthcare is delivered in developing countries. So I wonder, what is it that we can do to ensure that we bring the best of the private sector to bear in making decisions about how we can influence how that healthcare is delivered? Dr. Berkley, I'll start with you.
So thank you so much, and I'm delighted to be here. And after Lois's wonderful comments, I'm not sure I should say anything else, but thank you for those comments and the fabulous welcome I've had here in Ottawa and the great meeting I had with the minister and yourself and parliamentarians today, and it's really been wonderful. And of course, I want to thank the Canadian Network for Maternal and Neonatal and Child Health for hosting this, and the Aga Khan as well as the Canadian government for all they have done for Gavi. You know, I think the first thing to say is that the big problems of the world are not going to be solved by government or by the UN or by the private sector or by civil society. What they're going to be solved in is interesting new ways of those groups working together. And I think that I can't emphasize that enough. When people think about Gavi, they think about, you know, the MDG4 and focusing on the issues that we're going to talk about. But MDG8, which is about new development partnerships, they're just as important. And what's special about that is it's taking advantage of the skill sets that everyone has. Gavi doesn't have people on the ground. We work with government systems, and that's important for sustainability, and we'll come back to that. But it also means working with WHO for some of their specific skill sets and regulatory issues, working with UNICEF for helping with procurement and the work they can do in creating demand, working for the World Bank in issues on financing, and working with the private sector for what they bring to the table. So let me give a couple of examples. You've already heard about the advanced market commitment, an interesting way to artificially create a market. We also, another innovative financing mechanism that Gavi had is called the Innovative Financing Facility for Immunization. So this was a case where a number of donors stepped forward and made long-term guarantees. Now, with those guarantees, we were able to go to the private capital markets and float bonds whose rating is actually better than the ratings of our individual donors because of the combined risk that's there. And we were able to raise $4.5 billion from those capital markets. Now, that helps us because we can raise those at any time, and that money can be moved back and forth in time, including front-loading, which was very important early days of Gavi. But the other thing that's happened is it's created interesting consumer demand. So the iridashi market, which we've done a lot of these bonds in Japan, have led to mothers wanting to buy these bonds. And the reason they do it is they call them vaccine bonds, and what they know is they're getting a good return, that's important to them, but they also know that they're making a difference, they're doing good. So that's an example of taking advantage of working with banking sector, working with the markets that are there, bringing consumers in and engaging. Let me give you another example. As we move into the next phase of Gavi, you've heard about what we've done so far, but we're going to double the effort in the next 5 years. Instead of 13 years up until now for preventing 6 million deaths, we'll do another 6 million lives or deaths prevented in the next 5-year period. To do that, it's going to be critical that we reach the unreached. That's the next challenge. How do we finish this job? How do we extend the promises made and do that? To do that, we need expertise that exists in the private sector. We need to improve the supply chain. We need better data systems. If we were to just use the systems designed in the public sector, it would be a terrible mistake. But we also can't go to a company and say, gee, we want to use FedEx's system or Coke's system or, Walmart's system. What we need is pieces of those and the technology and experience they have, and then to take that to bear on the problems that exist. So we're working in Mozambique with Vodafone, and what they're doing is helping us do vital registration, which is critical because most women are born, live, and die in the developing world without being registered. But what they're also doing is helping us enroll people in immunization. And when they do that, we're able to follow up. So if a woman doesn't come back with her children for immunizations, we can go ahead and reach out to them. Of course, we'll rigorously evaluate this. And assuming it looks good, we'll continue to expand working with them, but also then take it to other private companies. I have many more examples, but I think those 2 examples give you a flavor of the type of work we're trying to do.
Mr. Levanon, you're a shining example of that expertise that's available in the private sector. What are your opinions about how we can bring the best of the private sector to bear?
Yeah, well, first of all, I'm delighted to be here and to participate in this panel and be able to share some of these experiences. And as Catherine, as you pointed out, I've been in the industry for over 30 years. And I do recall back in the early 90s being involved at meetings in Geneva discussing UNICEF's expanded program on immunization, which was targeting the 6 childhood diseases, and I think was really the beginning of all that's happened since.
Can I just say that its 40th anniversary is in 2 weeks,
Wow,
and it's going to be celebrated.
Yeah.
So.
But even then, we were having industry and groups come together to talk about how we could make it work. And of course, price was a major issue, and supply, and all of those sorts of things. But as I look on what's happened now, and the work that Gavi's been doing, the partnerships, how we're all coming together, I think when some of these mechanisms were first announced and the financings were first in place, industry wasn't sure what to do. And I think we've collaborated more and got together. And Sanofi Pasteur's vision is a world in which no one suffers or dies from a vaccine-preventable disease. And we know we're not there yet, but it is something that drives us. And if I just take a couple of examples where Sanofi Pasteur has been partnering and doing some things that we might not have done a few years ago. Polio was something we've been involved with for many years. In fact, I was doing some research. I think we've delivered over 5 billion doses of oral polio vaccine over the past 2 decades. We know that polio can be eradicated from the face of the earth, like smallpox. It hasn't been done yet. I think the current thinking is now that we'll need some injectable polio vaccines to play a role in that. And Sanofi Pasteur is expanding our production. We'll be supplying hundreds of millions of doses of vaccine at prices that were probably unheard of years ago, or were unheard of years ago. And there's reasons we could explore why that works. Yellow fever is another one where we've partnered, where we partnered with Gavi and other groups to supply yellow fever vaccine. And we currently can supply about 15 to 18 million doses. We're doing a major capital expansion to be able to supply 50 million doses a year. So these are real-life examples of industry working with the groups like Gavi, UNICEF, and others, Gates Foundation, to make a difference and to really provide these products which otherwise would not have been provided.
Just to follow up on that, how do you encourage other organizations and companies like your own to make the kind of commitment that you have? Is it still difficult to do? Is it less difficult than it was?
I think as an industry, we talk a lot about patient centricity and putting the patient at the heart of it. I think our industry is changing, and I'm talking the broader pharmaceutical. The blockbuster products are not there anymore. People will be looking at more targeted therapies, and they're looking at all aspects of solutions. So if you do a list, you can look at a number of companies that are partnering with other groups to deal with some of these things. Malaria is one, for example, that our company is working with groups on. I again reviewed a list of a number of people. I think there's more and more of that. People understand that's what we need to do, and that the world is changing. And the sense of social responsibility, sustainability, I think is very much at the forefront of the industry as large.
Can I say a little bit on that?
Sure.
I think the other thing that is really important is how we make this into a win-win proposition. You know, vaccines are public health interventions, and if you talk to the people working in the vaccine industry, and I'm sure you know this, they are in essence public health people. They want to do the right thing. They want to get them out to every person. The problem in the past has been there hasn't been a market. There hasn't been a reliable source of funding to get it. There hasn't been a mechanism. And what Gavi did is created that market, and it's allowed the pharmaceutical industry to think about this, to consider those markets, to have demand that they know is going to exist so they can expand their production lines, et cetera, to make it happen. But the other thing is it helps the industry because as they increase their volumes, they produce with more efficiency. The cost of their products, the COGS, cost of the goods sold go down, and also they get entree into countries that are then growing over time, and so they're able to be in those marketplaces. And lastly, you know, other now companies are coming in from around the world. In the developing world, now half of our manufacturers are coming out of the developing world, and so we're creating a healthy marketplace. So this is really a win-win situation. It's not about going and, you know, beating people up to make something happen. It's about working hand in hand to make it such that, you know, everybody wins.
Mr. Spicer, I promise I haven't forgotten about you. Give us your thoughts as well on the issue of how we can bring the best of the private sector to bear on this.
Sure. Well, first I'd just like to echo my fellow panelists' gratitude for Lois for your very personal remarks, very sincere, and also to the Aga Khan and to Results as well for that. I'd like to throw a shout out to the Department of Foreign Affairs, Trade and Development, only because I worked there when it was CETA. We have one thing in common, and that is there is so little recognition, let's say, of some of the projects and approaches that are so truly innovative that have transformed the world when it comes to Canadian innovation. And there's part of me that wonders, why is that? Was there a meeting one day where we just decided we were going to be quiet and shy about it? I wasn't there. I don't think any of you were there. Anyway, so I have a deep curiosity about that piece. I want to just say a few things about, and I'm also very grateful and honored to be on the panel with both of you, and your remarks are very inspiring. I want to say a few things about pieces that we have in common with Gavi on the innovation front, just to give you a flavor of that private sector element that we have in common, being a bit of a homegrown Canadian success story at the Micronutrient Initiative. Gavi and MI are innovative initiatives that get things done and deliver results at scale. And they do that only by working with the private sector. It's the same with the MI. We deliver low-cost, high-impact interventions. That's another sort of signature, if you like, of the results we achieve. And we can both trace elements of our success in the MI fully, and in Gavi, certainly, in a meaningful way, to Canadian leadership. We've heard a little bit about the AMC and MI's global success. Where we're different is that I think a lot of people know about Gavi. I know about Gavi. I'm psyched to be on a panel with Gavi. I think Gavi makes a huge impact in the world. But it might surprise many of you to know that the Micronutrient Initiative reaches 500 million people every year. And that in the last 5 years, this sort of headquartered in Canada with global impact organization has saved 1 million lives and prevented 30 million children from suffering permanent mental impairment. And that's pretty impressive, but we don't really talk about it that much. So on the private sector piece, for the MI, it's part of our DNA going way back to the beginning. Again, not something that not many people know. So it's never been a question of should we engage with the private sector. It's how can we do more and how can we do it better? That's been the question. And I want to give you one example. And God bless my comms team who gave me props before coming here. Look at this thing. I sat looking at this in my office because I couldn't quite believe it was like this. This looks like a little sweetheart, those little red candies you get on Valentine's Day, teardrop shaped. This is vitamin A. And if you can get 2 of these into one child, you have a very good chance of improving their odds of survival. And I bet none of you know how many of these things the MI, Canada's MI, has shipped around the world. That's 8 billion of these things. Every year we reach 200 million children. And you know how that happened? This little thing, which looks very innocuous, is the perfect example of what it looks like when the public and the private sector come together. There was no market for vitamin A. Seth, to your point about markets, there was no main supplier, there was no main demand. What did we do? We partnered with the government of Canada with their support. We created a market. We created the demand for that product. We worked with the private sector company. You would not believe how much technology is actually in this little pill. This is heat stable to 50 degrees centigrade. This has a shelf life of 3 years. And it's shaped perfectly so a health worker can snip the end off and put it into a child's mouth. And that is what happens when public sector market shaping and private sector technological innovation come together. And not a lot of people know about it, but I think they should. They really should. So that's the example of vitamin A. In many ways, we were kind of an AMC before the concept of an advanced market commitment was formalized and made as great as Gavi made it. So if I think about private sector again, just briefly to say, I wish private sector would realize they had a lot more power than they did in the following way. The private sector has a sphere of control where they determine their products, they determine their research agenda, they have impact on their staff, their supply chains, the consultants, the communities within which they work, and they have a huge influence, which I'd love to see more of. Their connections, the larger companies with governments, if you could link them together in new partnerships, would help us overcome some of the policy obstacles we have for delivery in many cases. So the opportunities for partnerships having impact not only in delivery and new technology and innovative financing, but also the influence piece. That's something in a very positive way we've got to look at too. So Lois said something briefly that I was coming to my last point here, that struck with me. And she said, you know, even though a lot has been accomplished and this is really fundamentally a good news story, there's still a however. We still didn't quite reach the target, so we're going to double down. We're going to keep pushing. We're going to do it, and Canada's going to be way out in front on that, which is something that makes me proud to be Canadian. But let's think about tomorrow. I don't mean the philosophical random time in the future. I mean tomorrow, Friday. What do we want to know about tomorrow, Friday? Tomorrow, Friday, probably about 1 billion kids are going to wake up hungry. Many of them are probably going to die because they don't have the vaccines that they need, because we're not reaching the unreached. That's why we need to do more. And of the, let's say, 7 million children roughly that are still dying every year, even though we've cut it down from 12, from preventable causes, which is insane when you think about it, considering where we spend our money, about 40% of those are due to undernutrition. Why? So mothers aren't getting the vitamins and minerals they need, so their kids don't get the vitamins and minerals they need, so when disease comes, they don't just get sick, they die. And we can change that. That's the crazy thing. We can actually change that in a very quick and meaningful way. So look, I just want to close, as I often do, because I love Proverbs, with a statement in Amharic, and that just kind of underlines the point. So in Ethiopia, they like to say, dir biabir an besa yasir. And that means if all of us put our webs together, we can even catch a lion. So the lion that we're all trying to catch when we're talking about private sector engagement, and not just that, but Seth, you're saying all hands on deck, right? And that's exactly what it is. The lion we're trying to catch is to try and meet and exceed the 2015 goals on our way to ending preventable maternal and child deaths. Thanks.
I want to talk a little bit about the financial aspect of all of this, but before we do that, we've talked about how we can bring the best of the private sector to bear, but I'd like also to discuss how these public-private partnerships have in fact impacted the way that you work. How have they impacted Gavi? How have they impacted Sanofi Pasteur? How have they impacted both organizations who are private and those who are public?
Well, I mean, again, it is all about using the best that the world has to offer in whatever sector they are. But for many of the things we work, innovation sits in the private sector, and so it's trying to capture those innovations, whether it be in the financial sector or in delivery or in reaching people, in mapping, what's going on as a mechanism. And for me, the challenge in going forward is to make this win-win situation across a range of partnerships. The other side of it, though, is having the data. Data is king, and we're talking about a data revolution for development. If we can't measure it, then not only don't we know what we do, but then we don't know where we're missing it. And we have to be open and honest about it. What you want to know, when somebody comes and says to me, everything's going great, I know they haven't done anything, because these are tough things. So the question is, where is coverage good? Where's it not good? Who are we missing and why? And around polio, we've had some really interesting innovations. So Mr. Gates, who's passionate, this is his most important cause, he said, how are we reaching this? Let's figure out new ways to map. Let's use, the satellites that exist and geo-mapping to go out and ask the question, triangulate against what we know. And all of a sudden you find there are whole communities that are not being recognized, and sometimes politically not being recognized intentionally. And so by doing that, you then identify those communities. It allows them to be reached and included in this, and that's important for disease eradication, but it's important for reaching the people who are most vulnerable. And so, for me, if we have systems that are working fine, that's great, but we have to have that continuous improvement loop to ask where it's not working, and then what can we do better? And that is, any industry that has survived has done that. It's morphed constantly, it's changed constantly, and that's why we have to make sure that public sector institutions or partnerships go through exactly that process. When we stop innovating, when we stop changing, we die.
One of the big differences I see is just the time and effort that people in our company are devoting to these kind of activities. So rather than, years ago, maybe dismiss it as a low price opportunity and, should you pursue it or not, people all the way up to the CEO are involved with collaborations, partnerships, agreements. I'll give you two other examples. We just signed an agreement with a South Korean company to develop a pneumococcal conjugate vaccine. We heard earlier about the needs for that. And that's not an area of research that we were in. So we have now decided to work with that company on the development, and we put considerable time and effort into it. And when it was announced, it was a big deal. It was a big deal within the company. A couple of years ago, we bought a company called Shanta Biologics in India. And again, that was all about access for that company to meet the needs of these markets, oral cholera vaccine, and to be a bridge for the emerging markets and to be able to enter in these kind of agreements. And so people, as I say, across the globe, I'm part of the Global Commercial Management Committee, and that group, we have the US and Europe and everything else, but we spend a lot of time and effort talking about emerging markets and the needs and these kind of markets and these kind of partnerships and what do we need to do there. And it dominates the agenda. And that just would not have been the case before some of these successful partnerships came about.
Do you also feel pressure, not just from non-governmental organizations and those working in the field, but also from average, regular citizens who are concerned about the world around them and who want to see the companies from whom they receive their drugs take a bigger role?
I think so. And I think, and we were talking earlier about people in the vaccine industry are basically public health people. And they want to do good, and it's kind of a different breed in some sense. So we're automatically already there thinking about that, and that's part of what we want to do, and that's part of. So when I talked about our vision, which is on our wall, it is something that we talk about, and people do have pride in their work. So it really is that public health good, and the whole debate about health system sustainability and so on. We love the side we're on, prevention. I mean, is an important part of it, and we look at the good that vaccines can do. So it really is at the heart of what we do and how we feel, and people feel very good about it. We have some co-op students. We bring in quite a few co-op students, 60 to 100 a year, and they're in real production. And we get them to make presentations to visitors who come in. And I noticed the last couple of times, they had their own slide at the end about our sustainability efforts. And of global sustainability efforts, including the Gavi collaborations and other things. These are things that drive them and motivate them that they put on the presentation. It took me 2 or 3 times to realize, how does that fit? Oh, because they're proud of that. That's what they're doing.
Right. Let's talk a little bit about the financial stability aspect, because it's crucial. I mean, it's a crucial element to the whole discussion. How do you make it financially sustainable? Because obviously it's critical for an organization like Gavi or the Micronutrient Initiative. It's also critical to the businesses who are developing the drugs or the vaccines. How do you make it financial? Is it possible even to make it financially?
Absolutely. So, you know, it's core to our model. So what happens is a country goes out and says, we want this vaccine. They have to have some criteria to show that they're able to take it out. But there's no free lunch. They pay for every dose of vaccine. If you're very, very poor, they pay a little bit. As they get wealthier, they pay more. And then eventually they graduate. And so the idea is that when they first start, it might have taken 6, 8, 10% of their health budgets to pay for those vaccines. That's too much. But by the time they get to graduation, which in our case is $1,570, it gets just by inflation, that's why it's an odd number, then it would be between 0.3 and 0.6% of their health expenditures, which is a fiscal space that any country can afford. So by definition, it's sustainable. But the world is changing. And now here's a very important point that we have to all think about. And that is that when Gavi was started, 90% of poor people lived in poor countries with poor infrastructure. And so it was quite easy to target those. Today, 70% of poor people live in middle-income countries. And so they're pockets of poor. So what do we do in those circumstances? And it's hard to go to donors and say, you should take countries that otherwise seem wealthy. So what we need to do is work in a different way with those countries to try to get them to focus on those populations, but also give them the tools necessary. So one of the things we're talking about is how do we work with them to make the market better? How do we work with the private sector to get pricing that makes sense for these countries, that both makes sense for the companies, but also makes sense for those countries so that they can have access for vaccines in those populations. That's going to be critical for the countries that graduate from Gavi. We have 20 countries now in the process of graduation. And success is going to be when these countries are standing on their own 2 feet, continuing these programs, and their ministries of finance and, you know, other ministries are fully behind them.
Joel Spicer?
Yeah, good question. Look, I want to say that many governments are evolving from a model where they see themselves as the sole provider of services to one where they are increasingly looking at how to become strategic purchasers of services and playing more of a quality control function and a monitoring function. And there's a lot in sustainability that has to do with getting more health per dollar spent. And that's another example back to the private sector where more business thinking, more proof of concept of innovation is required before governments feel comfortable taking the risk to organize their healthcare delivery in a different way. Just to give you a concrete example of the MI and some of the projects we're working on in terms of trying to get it to a more sustainable place. With salt iodization, we approach it in 2 different ways. We've got one example from Andhra Pradesh where we provide an incentive to private sector salt manufacturers to iodize their salt. So the more they iodize, the more of an incentive they get. And it gets to the place where actually the market can take over. We can phase that incentive away, and then it goes. So the people are buying a much better product that's having a higher impact on their health status. In some cases, we provide that bridge with helping them purchase quality control equipment so that their product gets to market so they can keep it high quality so people keep buying it and get it to scale. So in many cases, the contracting model as well is something that's helping bring greater efficiency into the system. But I think about it in 3 ways. There's ways that increase access That's got to be the sustainable piece. Like, who cares if a system is sustainable if it's missing 40% of the population in a way? You've got to get the best of both worlds. So that's another place where the private sector comes into play, finding innovative ways, because it's a market. Who's the best at cracking into markets? Private sector. So increasing access, increasing quality, and maintaining, at the very least, quality, and increasing the efficiency. So if you take the same amount of money that governments spend and you deploy it more effectively with making sure you cover the low-cost, high-impact things like vaccines, like micronutrients first, you introduce a better system that's more sustainable as well for government.
I mean, you have to basically maintain a sustainable for-profit company while also making these investments. How do you do that?
Yeah, and one of the concepts that plays very well to the Gavi country breakdown is what we call tiered pricing. And essentially, it's offering different prices to different markets depending on certain criteria. And so that the weighted average allows the company to be profitable. I mean, vaccines are very difficult to make. I could spend an hour on that, which I won't. But and we spend, you know, €1 million a day on R&D. So you have to look at how can you do that. Now, by having these countries, as Dr. Berkeley said, the volume increases, so that's great. You can spread your costs over more. And you can look at different tiers depending on income levels and offer different prices based on that. But then you need a couple criteria. You need to make sure there's no sort of crossing from one market to the other. And it's not sort of parallel imports between them. And you have to, you know, you put prices in that way. And as countries graduate, so to speak, they'll go to different pricing. So that's really a concept that works quite well and is one way of making sure you can have a balance on the financial return versus the need and getting products to all the countries that require them.
And if anybody's interested in that concept, 2 weeks ago in Lancet, I published a viewpoint on the power of tiered markets to get vaccines out. So.
I'd like to open up the floor to questions from the audience as well. If you do have a question, I think we're okay to, well, why don't we do have mics in the audience. Great.
Mics if the camera's going to capture them.
Yes, good point. So we'll ask you to just put your hand up or stand, and someone with a microphone will come to you so that you can ask your question. And in the meantime, we have a gentleman here. I'll ask you also to say your name if you don't mind.
Thank you. Yeah, my name's Don Sutherland. You've been using the phrase health care, I think, rather loosely here. And on the one hand, some of our speakers are in the prevention business, which is about health or the prevention side. Maybe the speakers could talk about this balance between what ends up being expensive, which is the health care side, and the prevention strategy side.
Great. Who'd like to tackle that first?
At the end of the day, the world is in a crisis about health care, and you know, there are different stages in it. My country, I come from the U.S., is at one extreme of craziness in terms of what it spends now on health care, and that is not sustainable, clearly. And then we have many countries who spend almost nothing, and that's a huge problem. For all of them, the core, and I think you've already said this, is to try to deal with the most important cost-effective interventions first around prevention, because what that does is ultimately reduces the burden. So there was a 20-year follow-up for the World Development Report of 1993, Investing in Health, this year, a Lancet Commission on Global Health, and they looked at where to go by 2035. And remarkably, it suggested that, in fact, we undervalue the investments in health. A number of Nobel laureate economists were involved with that. But they also said that there was a series of investments one could make. And if they made those investments, we could do something extraordinary. So, 200 years ago, everybody was poor and unhealthy. And then you had the Industrial Revolution, and a number of countries got wealthy, people got wealthy, and their health pulled out. And you still had poor people who are unhealthy. But what this commission said is by 2035, if you invested in a range of interventions, including maternal and child health, but including in prevention against non-communicable diseases and micronutrient and a range of other issues, that in fact we could have a grand convergence in health such that even people who aren't wealthy wealthy could have the health of wealthy populations. And I think that's really the view. That's where we've got to go. And there's some discussion now about whether this should be one of the organizing principles for the post-2015 agenda around health, if there is going to be one, which we certainly hope there is.
I'll just add to that if I could. From the MI perspective, that's a crucial piece, and that's where internally we talk about our value added. When you look at strengthening the immune system within a health system that you're also trying to strengthen, that's got to be one of the first places to start. So from a vitamin A distribution point of view, we know the impact that has on strengthening the immune system, avoiding preventable blindness, with salt and the impacts of measles and other diseases as well. With salt iodization, it's about preventing permanent mental impairment. And if you follow that line through from health into economic development, if populations have iodized salt, then the mean IQ goes up 13 to 15 points. What is 13 to 15 IQ points worth in the economic development and creativity and innovation and productivity of a country? And the answer is, it's beyond price. Iron and folate to stop hemorrhage, calcium to stop preeclampsia for women in childbirth, to prevent them from dying. This is saving not only lives, but saving health system dollars as well. And to Seth's point, my go-to place for that is the Copenhagen Consensus, right? And when you get a group of eminent Nobel laureates together and you ask them the question, if you had $75 billion and you had all these problems to solve, how would you allocate your money for maximum impact? And they looked at like response to natural disasters, health, hunger, across the board. And vaccines in the top three. The top one was bundled interventions, nutrition interventions for preschool children, including micronutrient supplementation, deworming, complementary feeding, these kind of bundles. That supports your earlier question, Catherine, which was about bringing things together a little bit. It's not about doing things separately. It's about that convergence that Seth was talking about too. One example of where we're more involved on the treatment side in a good synergy with Gavi is on diarrheal disease. So you've got Gavi on the prevention side with rotavirus vaccine, and you've got MI and other partners like UNICEF on the treatment side with zinc and oral rehydration salts. So there is a nice balance in that regard, but ultimately the prevention side is going to get your dollars going a lot farther. There's no question, Don.
I think the health system sustainability debate is, and we've talked about it, such a key issue. In some ways, as I reflect on it, I think what we've been talking about for the last little bit at this level is what needs to happen at the broader level. That we really need to take these partnership and collaboration discussions and start talking about these real issues. And all the participants in the system, I think it's going to take a partnership of that source, much bigger, much more magnitude, but that's where it's got to be at. And one of the issues is our system, I'm sure another, is very siloed. And savings you make in one area don't get reflected in others. And the fact that there are more people getting sick, even if you keep them out of the hospital, well, hospital stays are still going up. They would have gone up more. One of the examples, again, back to vaccines, think about if we didn't have a polio vaccine, how many iron lungs would we have? And I think it does take critical investments to change it, but it takes them to be intelligent investments that people recognize and can look at the long-term impact. And we need that kind of discussion to happen, that kind of debate. Is
there a willingness?
You have to ask different people have different views. I think some of us are going to try to push that. And you did mention that I'm chair of RX&D, which is the industry association. And during that mandate, one of the things I want to do is talk to stakeholders across the country. And what can we do to be part of the solution? And how can we work together? And that will be one example. But that's just one small piece.
The other thing that's happening is, as we transition across the world into aging populations, once we save children, we end up with chronic disease, and that's just a natural thing. And there's a lot of prevention that can be done, but also we're shifting. And today, for example, we have 2 cancer vaccines we're rolling out as part of Gavi. And I think more and more we're going to see that type of R&D focus to try to create prevention, both from non-smoking and reducing excess alcohol consumption and better exercise and things like that, better nutrition. But we're also going to have ways to vaccinate or treat to prevent disease, which will be very important.
Do we have another question from the, yes? She's coming just around the side.
Thank you. Julie Savard-Shaw, Results Canada. A number of you mentioned the goal of reaching the hardest to reach in the post-2015 era, with both vaccines and nutrition interventions as part of a broader health interventions. What role do you think the private sector can play in that process of reaching those furthest communities and the hardest to reach children?
I mean, I'm sure we all have examples. I've given some examples of mapping or communications technology or better data. And I think the other thing that we can talk about is traditionally governments have taken on a lot of the services themselves. Is the government the best repairer of vehicles and transport? Are they the best people to do logistics supply chain? Well, I think the answer we would all say is probably no. So one of the things we're trying to work with is getting countries comfortable in their own countries in engaging with local private sector who can bring those skills to the table. Maintenance contracts so that when they have vehicles, those vehicles can keep running most of the time. When they have cold chain and fridges, those fridges are running most of the time. And that's a mindset change, because in the old days it was let's procure the product. Great, there it is. Didn't come with the maintenance contracts, didn't come with spare parts, didn't come with the other issues, weren't necessarily particular fridges for off the grid versus on the grid, where solar was critical, et cetera. And that change, which again is key the way industry operates, will increase the efficiencies of these enormously.
Yeah, I couldn't agree more. And I think, just like the vitamin A, we could get vaccines. One of the things we have to do is make sure they're stable and thermostable, and they don't freeze when they go up north, and they're still usable when they're in the desert sitting on the tarmac for 48 hours. But from there, they have to get to people, as we're talking about, and they don't always get there the way they need to. And these kind of innovative solutions, with, again, partnerships with groups who can do that, who have the expertise in that, with local groups who have that as well. Those are the kind of things that have to happen. I think there's a lot of progress that's been made, and there's still more innovation that needs to be done.
Yeah, and just to add to that, I would say the future of global health belongs to the welders. And just to explain myself, because that sounds fairly insane, welder, in my mind, is someone who has the ability to look across different sectors and in different groups and say, hey, you're doing this here. Well, that should be done there. Like, have you ever wondered why in some countries you can go and the restaurant will have a point of sale, but then down the street, if you ask someone about their healthcare experience, they have to fill out 40 pages to get an appendix removed? Like, the health sector is remarkably slow to adopt innovations coming from the outside, like remarkably slow. And that's one of the reasons why we need the private sector to come in. So it's about welding. Just to give you one additional example, if you look at some multinational companies that are working in remote areas, let's say, I'm thinking about mining companies here. If you look at the quality of healthcare they provide to their workers in areas where the government is unable to actually get it done, and you look at the fact that many private sector players are buying health commodities at a price that's 7, 10, 12 times more than the government, then surely the welder approach would be to say, well, government, why don't you provide these health commodities at the cost you get them, concessionally priced commodities, to these companies? And companies, why don't you expand your area of operations to include the communities, not just your workers, because those workers go home to the communities. And if they've got infectious diseases, for example, they pass it on, but they're intimately connected. There's no separating a worker from his family. What would it take to get them to expand their impact in the world and beyond to communities that are labor sending, for example? So there are lots of ways other sectors are way ahead of health sector in terms of innovation. It's about grabbing that. It's about these kinds of meetings, thank you, Aga Khan, having these kinds of discussions, and making sure we don't miss opportunities. That's something in global health that drives me crazy, is you've got people over here that are delivering to the same target population, but they're incentivized only to deliver X and Y, but that population is dying of Z and A and B as well. Why don't we link it up? Link up the innovation that we are generating out there as well. That's one of the key ways to move forward.
Any other questions in the audience? Yes.
Thanks. This is Heidi Monk. And I appreciate your positive approach to thinking about all the good things that innovations and partnerships can bring to us. But I was wondering if you could share with us some of your thoughts about the challenges or limitations that you've seen in partnering.
Well, that's easy, and it's changing. So I think you've already heard that, when we started this, there was complete distrust, I have to say, between the public sector and industry. And that trust has only come by working together and sharing and discussing, and that's made a huge difference. But when there was distrust, there were many missteps that were made. Another common mistake is industry may think, we got all the solutions, we can just do it there. And as I said, I think it's very hard to take something off the shelf and use it somewhere else. Even companies that are operating in these countries, Coca-Cola that's kind of everywhere, doesn't necessarily mean that that technology is going to be completely applicable in a government center or in, health. And so it needs to be adapted and adjusted as is necessary. And lastly, one of the things that's hard in the private sector, and we love it because we are, in essence, this public-private, initiative, but the private sector sometimes underestimates what it takes to bring everybody along, because they're used to we got to do this in real time, we've got this bottom line we've got to work on. My board structure is a very unusual board structure. We have 28 board members. We have board members from the private sector. We have board members from research institutions, from civil society, from donor countries, from implementing countries, from the UN. Now, when you talk to a private sector person, that's not the usual structure that they expect around a board. But what that does, it's not the most effective mechanism, but what it does is it aligns people in a different way. So it takes some time to come to conclusions, but when you do it, you're bringing everybody along, and that's really useful. So those are a few ideas of things that haven't gone so well.
I was going to say a couple things. It's very challenging to get these discussions aligned. It's hard work to make it work, but then it does. But the other thing I alluded to earlier was, in the case of vaccines, they're very difficult to make. The bar keeps rising on the regulatory standards and the quality systems. And in fact, we could have situations where the vaccines are safe and effective, but they're not aligned from a quality perspective, and you may throw out very good product. And so what happens if we have a long-term commitment to supply product and we have a manufacturing issue? And there isn't much room financially anyway, and now people can't get the product. So it's those kind of things, and how you deal with stockpiles or other things, or situations where the demand exceeds the supply, and it takes a long time to put in capacity. Probably takes 5 to 8 years to build a facility and license it. So there can be some real supply challenges in getting the product, and different manufacturers will have different issues at different times. We all have.
And just to say again, I mentioned before that, yes, there can be challenges for sure, but what's needed is an eyes wide open approach to it. If there are sincere, not solely motivated by profit maximization imperatives, and they result in increases in access in a meaningful way to the poorest segment of the population, speaking in the global health context only, and an increase or a maintenance at least in the quality of the product and in the efficiency of the overall system, I say great. And there's no shortage of good intentions to harness and great capabilities to harness as well. One example from the MI, we work with a mining company called Teck, the largest zinc producer in the world. And we have a partnership with them called ZAC, the Zinc Alliance for Child Health. And we're free to operate wherever we want to operate. It's totally disconnected from their business model. They want to have impact in the world, and a meaningful impact in the world. And this year we're going to treat 11 million episodes of diarrhea as a result of that partnership directly. So the Canadian government is part of that partnership with that mining company. And it's working. That's just one example of a model, but eyes open, there's no question about it. But it's about bringing, we're going to do it anyway, right? So it's our core business to try and reach vulnerable women and children wherever we can. With the Government of Canada's support, other donors' support, we're going to do it anyway. And we want the private sector to come on board even more than they are, because we've seen what happens when they do. But it's not the other way around. It's not about the private sector doing this over here and bringing us on board to that imperative. It's about the all-hands-on-deck approach for a common objective.
I'm curious to know about the role of government in fostering these relationships, because we've heard from Lois Brown about the very important conference in May on maternal, child, and newborn health. And I wonder, what role does government play in fostering these relationships between the public and private sector, not just in the developing world, but also very much here in the developed world?
So, I mean, I think, first of all, Canada's leadership around Musoko 1 was incredibly important to get people to focus on this area, to make financial commitments, and that really helps. But let me give a slightly different example. So, Prime Minister Cameron, who hosted the last Gavi replenishment, decided to innovate a new matching fund to bring industry and get them engaged. And he agreed to match pound for pound any British company that would come and work with Gavi. And then if they brought their shareholders or their customers or somebody else, they would match that pound for pound. And that was a great initiative. Bill Gates liked it so much, he did it for other countries. So you say, well, that's great. And we've now done $130 million with companies and brought them online. I mentioned Vodafone, but many others. What's interesting, though, is the second thing they did is the Chancellor of the Exchequer hosted a meeting of CEOs of companies and said, you know, we'd like you to engage in this. We can take it from there, but without that introduction, you can imagine me going knocking on the door, we want you to come and work with us, and you know, they're gonna not necessarily be enthusiastic because they don't necessarily, you know, you don't get in at the right level, they're not listening. But when the Chancellor did it, a number of the companies said, you know, we're not interested in this, but most of them were interested. And I think that's a role government can play, is reach out to its industry and say why it makes sense to do it, and, you know, and incentivize. In this case, there was a financial incentive, and at the end, that really helps in the type of partnership that will move forward. It helps politically also because, of course, these companies are very important in the context of governments.
I think in addition to that, which is a very important role, again, the regulatory aspects of it, and you know, working with Health Canada and FDA and others on products that you're licensing and producing and having priorities set that way, and we've been able to turn situations around fairly quickly where the review is appropriate, but it's done in a way that people are putting resources on it. So I think that's a very, very significant aspect of it. And government can be cheerleaders and can, as Dr. Berkeley said, bring the people together and part of the overall economic development, financial health strategy for the country itself domestically, leveraging that internationally.
Yeah, these guys have said most of it all. I'd just add two small points. Sometimes in countries, governments can give tax breaks to manufacturers who need to get into the game to help offset the very high capital cost of getting in, and that's something I think they could look a little bit more at. And Seth, I have to say, I've got bond envy. You've got an immunization bond, and my dream is to see a development impact bond for nutrition. It doesn't exist yet in a way that I'd love to see it, but that is a place where government can help offset the risk of getting private capital into the market. And I don't think we've begun to scratch at the edges of that. That could be very transformative.
Questions? Yes.
Thank you. Fernando Santiago. I think I'm very interested in the discussion about mechanisms to finance, like innovation in financing. But I would also like to listen some comments on innovations in the way you handle property rights. And I mean, there's a lot of technologies involved. And sometimes that's an issue with the private sector. How do you actually share when you have these many actors and the technologies that are developed? How do you actually see some of the developments based on the experience that you have partnering with private sector and public sectors? Thank you.
It's a very interesting question. Mr. Levin, did you want to?
So it was about intellectual property rights and sharing. Mm-hmm. So is that what you? Yeah. So it's another important issue for the industry. In the cases of what we're talking about doing here, we are supplying products that may or may not have intellectual property rights attached to them, but we're selling end products. As you look at whether you produce in other countries, whether you have bulk or filling and packaging, there would usually be licensing agreements. There is a legislation that's been a topic in Canada about medicines and under certain conditions having them licensed, compulsory licenses to provide in certain countries. And again, that works when you make sure you restrict it to the countries that are required and it doesn't go to parallel markets and all of those sorts of things. So I think that can be an opportunity. And I think in the kind of collaborations and partnerships we're talking about, intellectual property, while it's very important in our industry, and that's a whole separate topic, it's all part of what goes into the mix when we sell these products at tiered pricing.
You know, it's also important to say that there got to be lots of different models for this. And so, you know, there are examples where it's a pure commercial product development, and then, you know, we help with scale up in large markets, driving down cost. And, you know, we're the biggest purchasers for a long time of auto-disabled syringes and trying to create injection safety around the world and kind of encouraging that, or vaccine vial monitors or others, you know. Then you have these public-private partnerships. I was involved with CAN-MNCH years ago here in Canada, but where government puts money in to help do innovation and product development and makes that available. PATH is an organization that does a lot of this, was involved in the vaccine vial monitors, for example. And then you have other things that are pure governmental interventions where, you know, they are working to try to make something happen, and they of course do that for the good of the world. And so I think the interesting thing is, you know, like all hands on deck, are using the appropriate model for what you're trying to do at that time, and then figuring out, obviously, about the intellectual property and know-how that's necessary.
I have one final question, but before we get to that, does someone in the audience have a final question? Then I guess it's your typical final question. How do we move forward from here? What can we do to increase these partnerships? What can we do to ensure that there are no bottlenecks? What can we do to really increase the reach moving forward?
Well, we're on the pathway. And so I think there's a great opportunity. The Prime Minister has now said that he's going to have a conference where he's going to refocus on some of these issues, and it's a great opportunity for Canada to provide leadership and talk about the importance of these partnerships, talk about the importance of engaging the public sector, showing the successes. Because again, although we're all singing, you know, from the same hymn sheet, and a very positive thing, as you've heard, the question is raised, not everybody has that trust, not everybody has that engagement. How do we expand that? How do we get others engaged? And last is just not to forget that this isn't finished yet. You know, it would be a tragedy to stop now. Yes, we've gone, you know, from more than 12 million deaths down to, you know, 6.5 million deaths, but we ought to be getting down to where there are no avoidable, you know, no preventable deaths, and that's an incredible gift. And it's not that expensive, but what it requires is money, it requires willpower, it requires partnership and new ways of working, and being accountable and having the systems to learn from it and change. And these are all things that we can do. We've shown we can do it, and it's something worthy of doing.
Yeah, I was going to try and avoid this soapbox speech part, but the more I hear about the Prime Minister's event and the more I learn about what different partners are doing within Canada and outside, the more I think, why are we doing such a lousy job of telling people about it, right? So to me, the Prime Minister's moment offers an opportunity to kind of set the record straight, and here's a little bit of my thinking on this. So again, we've heard we're not on track to reach the global targets. We agree we're not going to say, oh, well, and do what other donors do and move on to the next flavor of the week, right? So Canada has thrown its hat over the wall. We are doubling down effectively and saying, well, that's all right if we didn't meet it by 2015. We're not stopping until we do, period. Who's with us? That's basically the message that we're putting out there, and I find that inspiring. Now, on inspiration for a moment, I'm sorry, this is a Canadian-centric feeling. I don't normally watch hockey, but that feeling that you have when you saw the Canadian men's and women's hockey team win the gold, that feeling, that's what I'm talking about. If I could buy that product as a Canadian, I would buy it and consume it regularly, but I don't find it as much as I'd like to find it. This is one of those places, and Canadians need to find it here. And they can. I mean, there's no better cause than that. So what do? We fight for the underdog. We're good at that. We're good at bringing people together. We punch above our weight in global health and maternal and child health in particular. And we're just not great at talking about it. So if we become a little bit better at communicating to Canadians about how kick-ass it is, that many things that come out of Canada are, you're going to find that pride inspires people. You're going to see that inspiration is the jet fuel for innovation that we need. We need people to be switched on to see that innovation gets results in this area. A lot of innovation is being pulled into other areas and a lot of our best brains. And that will in turn help us keep punching above our weight. So moving forward, maybe it's unrealistic. I'd like to see a whole of government approach. This is not just development. This is our diplomacy. This is our trade. This should be our finance. All of these have areas to bear, and we should pick up the phone. My God, how many times in the course of history and in the past month are high-level people calling Canada and saying, we really need your help on this issue that's important to us. And we deliver. We consistently deliver. Are we picking up the phones? I'm sure we are. We should do that more. Let's pick up the phones. If we're gonna, let's challenge other donors to get on board, because Canada is actually very much walking the talk here. And we have built up the political capital. It's time to cash in some of that to say, okay, other donors, it's time to step up in lockstep with us. And we can also challenge the private sector in a very positive way, building on some successes to say, bring the best of what you have to the table, your product development, partners in shaping markets, and bringing your business approaches to delivery as well, because we need those. So I'm very excited about this moment moving forward. I think it's a once-in-a-lifetime opportunity.
Yeah, well, I've been speaking on behalf of Sanofi Pasteur globally and giving global examples. Let me just take a minute to talk about what we've done in Canada, and I'll get to your question. So we got our start in Canada 100 years ago. It's going to be the 100th anniversary of our entity on May 1st. And we got our start in a stable in downtown Toronto. Dr. John Fitzgerald, part of the University of Toronto, got $500, used his wife's dowry, and he bled 4 horses, and he got a diphtheria immune globulin, and 36,000 people used to die of it, and Toronto and Hamilton became diphtheria-free. That was the start. 1917 we moved, and all sorts of things happened. We got involved in polio development, we commercialized insulin, developed combination vaccines. Now that site in Toronto, 54 acres, there's about 1,300 people, 300 R&D, global R&D mandates, the production people, 800 or 900. We're a $1 billion enterprise. We export 95% of what we make around the world. And what I come back to is, I believe success begets success. And if you look at how we did that over the years, and we have to be world-class competitive or we wouldn't do it, and success begets success, and I think that's exactly where you started. Once you get these things going, it becomes a roller coaster. I remember in the year 2000 setting out our strategy, and we were struggling. We weren't sure if we were going to continue. We weren't sure if they're going to shut down our R&D, shut down our manufacturing. We did a cancer vaccine program, that R&D, and we expanded our production. And we dreamt about being a $1 billion enterprise back then, and through the steps it happened, and we are. So I think it's about dreaming and about being reasonably but optimistic and building on the success. And it becomes about a roller coaster, snowball
Yes.
going uphill.
As long as it's not a gerbil on a wheel, you're good. Thank you very much, Seth Berkley, Mark Levin, and Joel Spicer, very much for all of your comments, for your presence here today. Thank you also very much to all of you for your presence, for the work that you do, and for your questions. And now I believe it's over to Helen.
Hi. Just to wrap up quickly, and I'm Helen Scott. I'm the director of the Canadian Network for Maternal Newborn Child Health. And what an inspiring way to spend our afternoon this afternoon. As I was sitting there, I actually have some notes, but they don't actually reflect how I was feeling as I was sitting there, because the hat that I wear most of the time is that I'm a mom. And so Mr. Livonen, I've sat, in the pediatrician's office for endless hours waiting to vaccinate my children, and I hadn't really ever thought about, I sit there thinking about, are they going to feel well after, and are we going to when can we get home for the next meal? But that there are your organizations and the people and the R&D teams and your personal work and effort that make that possible, that make my children safe, because this is an important tool in the toolkit that I need as a mother to raise healthy children. So I say thank you for my children's health, because I know that Sanofi Pasteur provided the vaccines that vaccinated my children, so thank you. Dr. Berkley, when I hear the number 440 million children, I think of 440 million mothers who have that extra bit, and they don't have a chance to thank you, but if I could be humble enough to, on their behalf, say thank you, because that's a lot of moms that get to see the children being raised in a healthy way. Joel, you already know that I'm a fan of MI, so thank you very much for being here. We really appreciated your insights and the thoughts from all of you on some innovation. And really, the other thing that I took sitting in my seat there was, wow, you took a problem, which was that we couldn't afford to vaccinate kids. I can afford it because I'm wealthy in Canada. We couldn't afford to vaccinate kids. You just eliminated the problem. We took cost out of the issue, and now we're talking about how do we get it there. I know cost is still an issue. I know money's still an issue, but there are we know what the barriers are, right? We've talked about this Chris all the time, we know the solutions, we know the barriers, so now we just need to be inspired by some of the things we heard today, look at those with a different lens, turn them upside down, and just eliminate those barriers. So thank you for that inspiration as all of us work in the next 8 weeks to prepare for this summit that we think is going to launch us into this, what you've said is let's get down to zero, because it's possible. So thank you, and thank you, everyone.
And thank you to our moderator.
Thank you, Helen. That was